Christophe Willekens from France in Gustave Roussy Cancer Center in Paris. And I will speak about how to manage a patient, an older patient and frail patient with acute myeloid leukemia, and who will receive a treatment based on azacitidine and venetoclax. So there is actually a real benefit of this treatment in terms of response, but also in survival. The problem is that we are not totally certain about how to treat, how to use these drugs, and in part, especially the venetoclax. So the first thing is that in some frail patients, older and frail with a lot of comorbidities, it seems that is it possible to treat this patient with venetoclax, but with a reduced dose of venetoclax. So in that situation, we showed that you obtain the same response rates that the standard dose, and it seems that we have a low early mortality in that situation. So that's a very good point, and I think that all AML patients who are frail and old, they should receive veneza, and if there is some discussion and debate, you must treat this patient with a reduced dose of venetoclax. The second point and general point about the management of this patient is that you have to be very aware of that patient during the beginning of the treatment, and beginning means during the 3 to 4 months of treatment, because the first cycle you will obtain the response, and if whatever the dose of venetoclax you will give to the patient, he will have cytopenia, a profound cytopenia. So you will have to manage infection as soon as possible, because this is what killed the patient during the first month. And after that, when the patient is in response, you always will have to be careful about cytopenia. To be sure that the patient will continue the treatment until relapse or another adverse event. But this is the major point. The 3 to 4 months after the beginning of treatment, you will have to be careful about blood count, infection, and the need for transfusion. Usually we make blood count twice a week to be sure that there is no problem. And I think you sometimes in France we make a systematic appointment with the patient at the hospital, even if there is no special need like transfusion.